coronavirus is battering the upper Midwest. 5 states in that region now lead the nation in new cases. In Wisconsin alone, the positivity rate is upwards of 20%. This surge comes 5 months after my next guest warned Congress that the government was making dangerous decisions about the pandemic. Last spring, former BARDA vaccine director Rick Bright was demoted after he publicly pushed back on hydroxychloroquine, a treatment that was being advocated by the president. He was transferred to NIH, where he told NBC News he hadn't had any meaningful work since September. 2 weeks ago, he resigned from the government entirely. Writing in the Washington Post, the country is flying blind into what could be the darkest winter in modern history. Undoubtedly, millions more Americans will be infected with the coronavirus and influenza. Many thousands will die. Now more than ever before, the public needs to be able to rely on honest, non-politicized, and unmanipulated public health guidance from career scientists. Joining me now is HHS whistleblower Dr. Rick Bright. He is the former director of the Biomedical Advanced Research and Development Authority, BARDA. Rick, it's always good to see you, or Dr. Bright, I should say. I want to ask you about a recent report in the Washington Post. It talks about Dr. Scott Atlas, who essentially now is the head of the coronavirus task force. Apparently, according to the reporting, he is the one that has the president's ear. And on the subject of testing, as it was being advocated by others in the task force, including Dr. Birx, that more testing needed to be done, he was saying no, allegedly. He was saying the only people that need to be tested are the vulnerable populations, people say in nursing homes. We still don't have a very good testing apparatus in this country. There are blind spots. There's a delay in getting results back. What is that doing in our ability to fight this virus, especially in places where it's surging now, like the upper Midwest?
Katie, thanks for having me on today. You bring some really important points to the front of our conversation. Look at the rising number of cases that we're seeing across the Midwest and across our entire country right now. These increase in cases are a direct result of not having a plan in place by our federal government. The Trump administration has refused to listen to scientists from day one. They've refused to put in a national response plan to manage the pandemic. And when it comes down to testing, they have been all over the place, increasing some tests in some areas, decreasing testing in others, mixed messaging about slowing the testing down. And what it results in is not enough testing, not enough of the right kind of testing in the right places, chaos and confusion. That translates into the increased case counts we're seeing today. And that translates into increased hospitalization and increased deaths. It didn't have to be this way, Katie. We actually have a plan that we could have put in place. We actually have strategies that we could have implemented. But by having the President of the United States ignore credible scientists such as Dr. Fauci and others, and bring in someone such as Scott Atlas, who has no experience in pandemic response or infectious disease, and to listen to some of the unfounded ideas and outrageous ideas in some cases, and implement those ideas over the sound, experienced scientists is what is going to increase the duration and magnitude of this pandemic.
Political appointees, operatives you could call them, have been instituted or placed into some key areas of HHS, including at the CDC and reports at the FDA. Can the public trust right now what is coming out of those two agencies?
If the career scientists are allowed to speak up and share their information, share their knowledge, share their data, we can trust the hard work and expertise of those career scientists. However, what we're seeing in many cases is the political appointees, the commissioner of the FDA or the director of the CDC, bow to political pressure from President Trump and the White House. And when they bow to that political pressure, it destroys the credibility of their entire organization. It demoralizes career scientists, and it actually will distract them from doing their work. And they're trying to focus every day on ending this pandemic as quickly as possible.
Well, how do we tell the difference when the information comes out? How do we tell that it is career scientists who are sending this message out and it hasn't been manipulated or looked over, at least, by some of these political appointees who might have an agenda?
It's becoming increasingly difficult. I mean, we have seen the guidances written by experts at the CDC published on the CDC website. And then within hours or days, we see the White House take those guidances down, rewrite those guidances, manipulate that messaging to Americans, and then ask the CDC to repost those. So it is becoming increasingly challenging to do that. Again, it doesn't have to be this way. If we didn't have a leader in the White House who was intent on hiding the truth from Americans, we wouldn't have to worry about the messaging coming from the career scientists, because their voice would be the guidance, their voice would be heard loudly and clearly. So in order to get through this, so we can trust the data coming out from those career scientists, we need a leader in the White House who will listen to science and listen to those career scientists. And we don't have that right now.
Dr. Rick Bright, thanks so much for being on with us today. I would like to have you back on to talk more in depth about the vaccines that are currently being worked on and the confidence you have in those. So please do come back again soon. Let's consider this the start of a conversation. But thank you for now.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.